Hello, we're going to talk about alterations in skin integrity for your pediatric chapter 57. We didn't get to this in class, but it will be on your exam, so please just bear with me and I'll try to get through what we need to talk about. So dermatitis is our first topic, and this is all straight from your PowerPoint, so if you want to follow along with that would be great. So dermatitis is just a fancy word for skin inflammation. We have atopic dermatitis, which is another word for eczema. So I'm sure we all know what eczema looks like. It's that plaquey, scaly skin with lots of redness and irritation. And then we can have something called contact dermatitis. Contact dermatitis is directly from something that causes allergies or irritants of the skin. So right now I have a little bit of contact dermatitis right here from my glucose monitor. I had contact dermatitis because I am allergic to the tape that holds down my Dexcom monitor. So I would have contact dermatitis. So some signs and symptoms of contact dermatitis is erythema, edema, pruritus, vesicles, bullae that rupture and ooze, and crust. So in your chart, you actually have, or on your PowerPoint, you actually have pictures. So this is a good picture of your contact dermatitis. So with contact dermatitis, lots of skin barrier. There's really nothing that we can give prescribed to them, but lots of over-the-counter things. So emollient creams, we can give them ointments such as Aquaphor, stuff like that. And then if it gets really, really bad, then the doctor may resort to giving them steroids. But every time you have contact dermatitis, they're not going to say, here's a steroid, because steroids are really hard on your body. So with kids, if they have it really bad, then we'll focus on giving them the steroid. And then the doctor can also give them hydrocortisone creams, and they may prescribe antihistamines like Benadryl. So Benadryl right now is for 4 and up, but that may change because, medicine is ever evolving. The biggest thing with your topical steroids, if that is prescribed to someone with severe contact dermatitis, do not directly apply that to the open wound. Just think how that would feel. It would be lots of burning, and how do you explain that to possibly a baby or a toddler that I'm giving you this medicine to feel better, but it's going to hurt really bad. So just be aware of that whenever you're applying your topical steroids. Big thing, nursing interventions, teach the parents about signs and symptoms of infection. We can do wet dressings, and that's to help remove the crust of the lesions in the contact dermatitis. And then also, normally if they're going to get that steroid prescribed to them, they're going to be on it for 2 to 3 weeks. And then also with that, we want to avoid irritants that's causing it. So if your patient knows they're allergic to Pampers diapers, then don't use Pampers diapers, move to Huggies or another brand. So avoid those irritants. Diaper dermatitis is our next one. This is just a fancy word for diaper rash. Diaper rash happens when babies don't get their diapers changed as often as they need to. So if you have a baby that, or a toddler, whoever it may be, that has drank something very acidic, it's going to break down that skin a lot faster than what it would if you would change the diaper more frequently. So your PowerPoint has this nice picture of diaper dermatitis, and it is the most common of your contact dermatitises, and it's also very common in your 9 to 12 month olds. Because 9 to 12 months old, we are introducing juices and more foods that could be acidic, and that can change the pH of your feces and your urine. So those are the most at risk for having contact dermatitis. The big thing with them in treating, if you have diaper rash cream, every diaper change you are gently wiping it off and applying more. You're not scrubbing. Do not scrub it because that will hurt them and it'll peel their skin even more. Gently wipe and apply. And that will help build up that good barrier, and the more we have on there, the better. So you can have your topical cream and your barrier cream. I'll keep everything nice and moist and hopefully clear up your diaper rash. Our next topic is about skin lesions. Skin lesions that can lead to bacterial infections. Our first one is called impetigo. I'm sure everyone has heard of impetigo before, but it's those honey yellow crusts that form like right here under the nose, or it could be by the mouth, or wherever it may be, and it's highly, highly contagious. So if you have a little one that has went to daycare, they come and see you, and they have this impetigo, then you need to alert wherever they've been. Like, you need to be bleaching, disinfecting these toys, because it can cause all the other kids to get it. If you have like just a tiny little scrape underneath your nose, you're at risk for getting this. So impetigo, big thing with that, they are going to actually clean and wipe away the crust and then apply the medication that is prescribed to them to help clear up that impetigo. So since impetigo is a bacterial infection, they are going to be getting an antibiotic. So just think of your basic information for antibiotics. Continue the treatment, take the full route of full dose of medication, and just keep taking it until you're out of medication. Cellulitis is our next bacterial infection that we can get. That is where people get the infection in their skin, and it's going to cause like this deep red painful area, and it can spread very, very fast. So once someone has diagnosed they have cellulitis, it's very important to start them on IV antibiotics. And they will probably be in the hospital, especially if they're a child, for a couple days to get those high dose antibiotics going through. Some kids get to go home, especially if it's in a small area. But once again, it spreads super fast. My example, I had a child show in. They had a tiny little spot of cellulitis, and then the next day, you couldn't even see their eyeball. So cellulitis spreads really, really fast, and it's really important to get IV antibiotics for that. Next up, we have fungal infections. So our tinea fungal infections is what we're going to focus on. So the first one is called tinea capitis. So capitis we know is all up here. So a lot of people can call this cradle cap. The biggest thing with this is they are going to get a sulfide or ketoconazole shampoo, and they're going to have this 2 to 3 times a week. And they're going to scrub it in, leave it on there for about 10 minutes and let it all soak. And then they're going to take a fine-tooth comb and comb that out. And everyone in the family that lives in the same house as this person will have to do this as well to help prevent them from getting this. Tinea cruris is also known as jock itch. This is where we're going to have those lesions in the groin area. The big thing with this is they're going to get that topical antifungal agent, so miconazole or terbinafine, and they're going to be on this for about 4 to 6 weeks. We're also going to wash the area with our sulfide shampoo and wear loose clothing to help with dryness in the groin area. A lot of the times we tell parents once they apply those creams, just lay them down in front of a fan and let it kind of blow and make sure everything's fine and dry. Especially if they're little, then let them run around without a diaper on, especially if they're a baby or a toddler age. And if they're children that are potty trained, then just put loose clothing over them. Maybe don't put on underwear, but if you have to go out in public, definitely wear underwear, but just not tight fitting. And then tinea pedis, that is our athlete's foot. This is where it's going to get between the toes, and it can be painful, and it's very, very itchy. With this, they're going to get antifungal cream, and it can either be iconazole or cyclopirox. the big thing with this, after you put it on, allow it to air dry just like your jock hitch. And with this, whenever they go to put socks on or clothes in general, they need to put socks on before they put their pants on. Because think about it, if they're putting their pants on and they're putting their foot that has athlete's foot and it gets into the pants, it's going to get to their jock hitch. So that's not good. So make sure that they have 100% cotton socks on. They change them twice a day because feet get sweaty. And put on those socks before they get dressed. Next, we have our viral infections of the skin. The first one is called molluscum contagiosum. And yes, I know I sounded like Harry Potter when I said that. Not that cool. Molluscum contagiosum is something that is obviously viral, but it can spread very fast when skin is wet. So if you have a toddler that has it and they're taking a bath with the other sibling or whoever it may be, wet skin to skin contact is not good. So try not to do that. Don't let them share towels or any of that. Don't let them swim in pools. Don't let them go near water and anyone else, especially when they're wet, because then it's going to spread. And it's just these like raised little bumps on the skin, but it's very, very contagious. Before we move on to the friends, I just wanted to pop back and talk about eczema real fast. Eczema, there is no cure for eczema, and it's typically a long thing that happens throughout your life. There's no cure. But you can give low-dose steroid creams. You can give NSAIDs, do topical ointments, and antihistamines. And then some people, they actually prescribe for them to go and have like red light therapy or even UV therapy, so like tanning beds. I know someone that does that, and it takes away their eczema and it helps them. But we also know the bad side of tanning beds. But the big thing is, what triggers your eczema? Some people, it's stress. Stress is just something that we have to deal with and that can't get rid of it, so then we may have eczema outbreaks. Some people know that they're allergic to different detergents, so stay away from those. So just stay away from things that may trigger it. Now the fun part, we're going to talk about the friends that you can get. Lice. Lice is something that anyone can get. I hate lice. Makes me want to itch. Anyway, when you have lice, you're supposed to do the shampoo treatments and make sure that you use a fine-tooth comb and comb out all the nits that can be in it. And once all those are gone and gone away, then you should be good. Continue using the shampoo though for a couple days just to make sure that it's all gone. Also, if the child has like stuffed animals, bedding, whatever it may be, those things need to be suffocated. So they're going to be in trash bags for a few days. And then after that, they're going to be washed on hot water. And that will hopefully kill everything that's in there. If it were me, I would be, burning it all. But can't do that. So suffocate it in a trash bag and move on. Scabies is about the same thing. Scabies is something that you can get in your skin. It's also very contagious. You can spread them. Also, like, you're wanting to suffocate those, and you're wanting to use the creams and stuff that they prescribe to you for that.